Hello, interwebs, and welcome to yet another episode of the Trans Nerdy Podcast. I'm your host, Jessie Earl, and I hope everyone is doing really, really well today. So, welcome. Um, for today's topic one, what I wanted to talk about was healthcare, specifically healthcare and issues with going to the doctor for transgender people. Um, And part of the reason that I wanted to talk about this today is actually a few reasons. The first, and probably most evident to most people, is the recent fight in the House and the Senate against Paul Ryan's healthcare bill that was going to try to repeal and basically get rid of Obamacare. Um, and that was sort of a big deal because, especially for obviously it's a big deal overall, but within the trans community, that's actually was really, really huge and really, really important. And I saw a lot of it when, because I did a lot of activist work for the against the Paul Ryan's healthcare bill at the Los Angeles LGBT Center, which, by the way, is a great organization. So if you guys are in Los Angeles, I would highly recommend going to the Los Angeles LGBT Center, specifically the Leadership Lab, and they do a lot of really, really great activist work. Um, but going back to the transgender issue, uh, Obamacare was one of the first easily accessible healthcare programs that actually supported trans health rights. Getting access to things like estrogen or testosterone, hormone replacement therapy, which is a huge thing for a lot of transgender people. I mean, most transgender people do try to get hormone replacement therapy. Not every transgender person wants to get the surgery, but a significant portion do want to get hormone replacement therapy. And talking about the surgery, the gender reassignment surgery, the big one, that it's actually covered under Obamacare. Obviously, you still have to go through all the hoops and things that I've talked about in previous podcasts about that. Um, but it was something that you could get access to under Obamacare. So, Paul Ryan's healthcare bill would have taken a lot of these transgender health benefits away from a lot of transgender people. And that was really, really terrifying because, people who had just finally, after so long a time, had been given access to trans health, uh, just given access to trans health, suddenly have that taken away again. Which would have been terrible. And thankfully, Paul Ryan's healthcare bill was destroyed in this, or well, they rescinded it, and I'm sure it'll come back in some way, shape, or form in the future. But for the current foreseeable future, it's protected. So that is absolutely wonderful. And the next reason that I wanted to sort of talk about trans health issues was my own personal experience, having moved to Los Angeles and having to deal with it. Because before I moved to LA, I actually was fairly lucky in kind of having a good route through for a lot of sort of trans health benefits. So I'll talk about myself for a little bit, and then for a few minutes, and then I want to talk to you about just sort of some of the general discrimination that trans people face when it comes to healthcare. Um, Obviously, I've talked a lot about, and just recently, just a minute ago, talked about sort of the issues that it's hard to get actual trans-related benefits through healthcare and having a lot of insurances for the longest time. Recently, it's beginning better. Didn't recognize trans health benefits. So I'll talk into a little bit more about the actual discrimination that occurs when a trans person goes into the doctor's office. Um, but anyways, going to me specifically, my when I first came out as transgender, and I started seeking medical ways to deal with that, hormone replacement therapy, eventually getting the surgery, seeing a therapist, things like that. Um, I was lucky in that I lived in Ithaca, New York, and Ithaca, New York has a very strong transgender community. So they are. So the path was pretty much laid out for me. Like I was able to find a doctor and a therapist who had already done this several times before and knew how to treat transgender people, knew what transgender people needed, knew how to monitor trans health issues. For example, my doctor prescribed me estrogen or estradiol, a anti-androgen blocker, which sort of blocks testosterone and sort of the male hormones. Makes sense. But some side effects caused by, I think, mostly specifically the anti-androgen blocker, the androgen blocker, can cause like increased blood pressure, increased potassium, and can generally cause heart problems as well. You need to counteract that. So I was given this drug called hydrochlorothiazide to help counteract these negative side effects of that, and it actually worked pretty well. And I had some sort of heart issues. Like I remember I fainted once while I was at the gym. Sometimes I got a bit tired easier, things like that. Um, but generally, and so that they had to mess with my hormone levels. But generally speaking, my health was pretty good on hormone replacement therapy. Now, when I came to Los Angeles, and again, my experience is not terrible, but I had to become sort of my own advocate in a way. I had to become knowledgeable in my own health care. Not that I shouldn't be knowledgeable, but I basically had to prescribe myself. I went to several doctors, none of which, the ones that did know transgender health, didn't take my insurance, which was very unfortunate. Which, I could have gone and seen another doctor that, knew how to help transgender people better, but I would have had to pay a crazy amount of money to do so. So I finally found a doctor who would treat me as a trans person. But first things first is they know nothing about how to treat transgender people. So basically, I had to tell them all the dosages that I needed to take, how many times I needed to take them, how to monitor these things. Um, and what ended up happening is before they would actually allow me to continue my prescriptions that I had been on for 2 years at this point, they wouldn't continue it until I actually went to an endocrinologist, which is someone that actually checks your hormone levels, and does tests with them, which is fine. I understand if you don't know how to take care of a transgender person to go see an endocrinologist, but it's also I'm out of my medication. I was off my hormones for a couple weeks, which was kind of dangerous for me. It's like going through menopause, and it caused me to have a huge depression, both for the fact that I wasn't on the hormones and also like going off the hormones does cause emotional turmoil, just for obvious reasons. So I had to go and see this endocrinologist, which took a few weeks to actually get an appointment and get all set up. And I can see on the thing, there's my little Kazooie in the back there sleeping. Here she is. You can see her on the video. So, yeah. So I went to the endocrinologist, and then the endocrinologist had to send me to another doctor to try and get all my tests because they didn't actually do the tests while I was there. So basically, to get on my hormones while I was depressed and trying to deal with all this stuff, and also trying to deal with all my other, trying to find a job, trying to move into LA, I basically had to find a doctor. That doctor sent me to another doctor, set up an appointment for that doctor, took 2 weeks or so, and then actually set up an appointment with a third doctor. And then once I saw that third doctor and got all the tests, go back to the second doctor, talk with him, set up another appointment with him, then go back to the original doctor to finally get my prescriptions. It was not fun. It was a crazy rigmarole, and it took about a month before I could actually go back on hormones, and it was tough, really, a really tough month. Um, and even now, like I went to my doctor yesterday, and there was a different doctor than I usually have because this is just an office with a couple doctors. And even then, that doctor was like, "Oh, so what's your dosage? Is that the correct dosage?" She said, "Okay," and then she had to like look things up. And again, it's like I understand not having the knowledge, but it's distressing to me where I have to know my dosages, know what levels they are, what levels they're supposed to be, and then actually advocate for that at my doctor's office. And what if I had just forgotten that day? And I actually did have to think about it for a little bit to try and remember, well, what the heck is my dosage? Um, to try and get a prescription refill. So, all in all, I haven't faced a ton of discrimination, but it's just a pain in the butt to not have someone who knows how to deal with transgender health, and it's not something that anyone's really taught or is aware of. Um, so I just have to be super aware of my own. I have to be my own doctor in a way, and just basically go to this other doctor to get my prescriptions. So, before I wrap up this topic, I wanted to talk about generally more about. So that was basically my experience. I want to talk about more about what trans people face discrimination wise when it comes to healthcare issues and things like that. Um, and one of the biggest things, there's a wonderful article that recently came out by the Daily Dot. I have it pulled up right here. It's called "The Trans Broken Arm Syndrome and the Way Our Healthcare System Fails Trans People." And I would really recommend you go read this article. It's a very, really well done article. But the basic idea of trans broken arm syndrome and is the idea is that a trans person will go in to see a doctor, and any problem or issue that they may have is diagnosed as an issue caused by them being transgender. For example, you go in for a broken arm, and they say, "Oh, it must be because you're transgender, that you had a broken arm," which is, for those of you who don't know, obviously ridiculous. Um, so like things like going in for school related anxiety, and they're like, oh, maybe it's because you're trans, or going in for, like I said, a broken arm, or I'm even pointing out some of the things in the article. Go in for a stomach bug, and the doctor will say, oh, is it because you're making yourself sick because you're trans? And just things like that. uh, and obviously that doesn't lead to actually helping you. It just, number one, it makes you sees being transgender as a negative. That's the first thing, is like anything bad happening to you is because you're transgender. And being transgender is not a negative thing. It's not a bad thing. Obviously, yes, there can be health related issues with it, as I've experienced myself with my heart, but overall, it's not a negative thing to be transgender. So that's the first issue. And second, it just doesn't lead to actual diagnoses and actually dealing with what the problem is. So yeah, that's one of the major issues of the trans broken arm syndrome. And then also just general discrimination when it comes to doctors. Like, people will obviously, there's always the issue of misdiagnosing people, or going in, if you've had if you're a trans man and still have a vagina, still have to deal with vaginal related health, or if you're a trans woman who's had the surgery and needs to have vaginal related health, going to see a gynecologist, and the gynecologist saying, "Oh, you're in the wrong office. You shouldn't be here. I won't treat you." Because either you're a man and you shouldn't have a vagina, a trans man needing still can have a vagina and needs health benefits, or it needs to have that checked out, or if you're a trans woman like myself who needs to see a gynecologist to get things looked at. That's just how it goes. The vagina needs to be checked. I don't know why I became southern there for a vagina related joke, but there you go. You have to deal with it. It's a thing. Um, Sorry. Um, so yeah, trans health discrimination is a real issue that is very scary and can actually lead a lot of people to have anxiety about seeing their doctor, which is not something that should actually happen. You shouldn't feel anxious to see your doctor. If you're feeling sick, you should be able to go to your doctor and actually feel like you're going to be treated by said doctor. And it's honestly frustrating and disappointing that this hasn't been figured out yet. That trans people, there isn't a baseline level of knowledge on how to deal with transgender people. And again, I don't expect every doctor to know how to deal with every single problem at any given moment, but I do expect them to have a sort of baseline understanding of what the issues are, or that things like a broken arm aren't caused by being transgender, or even having basic knowledge of what being transgender is, and in a health-related way, and what that means. Um, so it's just frustrating and disappointing that we haven't standardized that yet, and that discrimination still occurs. Alright, well, that's it for topic 1, and thanks for joining me on it.